Good morning, Chairman. We are ready to begin.
Good morning, Denisha. If you'll conduct the roll call of board members, please.
Yes. Roger Folsom,
Here.
Tommy Hopkins,
Here.
Norm Boyd,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Robert Coles,
Here.
Kathleen Ruth,
Here.
Shane Mobley, Cynthia Rucker. Chairman, that concludes my roll call.
Thank you, Denisha. We have a quorum, so we'll call the meeting to order. I think we need to acknowledge that you informed me just prior to the meeting, Dr. Rucker has a new grandson, a grandchild born. So she will not be with us today. So we wish her and her family congratulations on that. We will look at the minutes from August 14th. Dr. Ruth, have you had a chance to review those minutes? And if so, would you recommend approval?
Yes, Mr. Chairman, the minutes have been reviewed and I move to approve the minutes for the previous meeting.
I have a motion for approval. Do we hear a second?
Second, Hopkins.
Tommy Hopkins has seconded the motion. Any further discussion, amendments, or corrections? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Motion's approved. Minutes are approved. This morning at 9 a.m., there was an audit committee meeting, and I'll call on committee chairman David Cruz to give us an update on that meeting. David?
Thank you, Mr. Chairman. This morning, the audit committee met primarily to hear an update on two audits. The first is the Medicaid dental program performance audit. This was a follow-up review of the original audit that was performed in 2021. There were 5 findings in the follow-up. Currently, all of those, of the 5 findings, there's still 3 to be addressed. The one has substantially been addressed and one partially addressed. But the department has made it a priority to address these 3 additional findings, and the one that's partially addressed, they have developed a structured and strategic approach to ensure a sustained effort to address these findings and bring the resources necessary to address the findings. The other report that was addressed is the state auditor's FY 2024 annual audit that's a part of the Georgia Annual Comprehensive Financial Report and Single Audit. David Chong, who is the Deputy Inspector General, gave a report on that audit and the findings that had been carried over from prior years. All of the findings are being addressed, and a number of them have already been completed. There will be 1 or 2 carried over to the FY 25 audit that's currently underway, but we believe those will be addressed in FY 25. So, Mr. Chairman, that's my report. The audit committee plans to meet again in December.
Thank you, David, for that report. Any board members have any questions for David regarding the audit committee meeting? Hearing none, we'll move on. Thank you, David, for that report again. Opening remarks from me this morning will be brief. I do feel compelled on this day of remembrance of the tragic 9/11 events 24 years ago to acknowledge that and make a couple remarks. I wrote this morning sitting around 5:30 a.m. at my kitchen island, so I'll be very, very brief in this, and I appreciate the privilege to make these remarks. Also, in the light of the assassination yesterday and all the recent horrific events we have witnessed in our country, we always know that evil will always be amongst us. Good people must continue to do good things. My vivid memory of 9/11 is probably some of yours, is not so much 9/11, which was tragic enough, but it's 9/12. How mightily we were unified as a country and as a nation, regardless of color, regardless of gender, political differences, or religious orthodoxy. We were all Americans, united. I hope we can get to that place once again. Please know how much I respect each of you for all the good that you endeavor to do on this board, this department, in this state, and in your own individual communities. Thanks to all of you for allowing me this privilege. Hug your loved ones, fly the flag, and continue to do good things. And with that, we'll move to the Commissioner's report. Dr. Burke.
Thank you, Mr. Chairman. Certainly echo your comments there, and certainly our thoughts and prayers are going out to all those that have been affected in the last few weeks, both from those remembering 9/11, but also those other recent events that you mentioned. I wanted to update the board on the rural transformation project that we're doing in conjunction with the reconciliation bill that was passed by Congress and signed into law by the president. It has, as we've mentioned before, has a very short timeline, but we have already done a good bit of work. We did have 3 open houses or open sessions in our rural parts of the state to get feedback from citizens and interested stakeholders. We'd had 1 virtual meeting that was obviously open statewide. We've received over 150 comments, and we're still having conversations with those interested parties on trying to refine those comments and put them into a package that meets the limitations that CMS has given us. There are limitations on not creating any funding cliffs, add-on payments or rates, things like that, they are telling us won't be approved. We're still waiting their final guidance, which is supposed to occur any time now. And we will, once that guidance is complete, we will, with great effort from our staff, use that time to make sure that our proposal that we bring to CMS for approval does what it is intended to do, which is to improve the health outcomes in Georgia, regardless of what zip code you live in, to make sure that we are innovative and thoughtful and using these new dollars for things that will help stabilize the rural health delivery system, which is, I know, as important to those of you that are serving on this board and our staff, and certainly to me. So I want to thank everybody for their hard work on that. Internally, there's going to be a lot of long days and nights coming up as we meet those very, very, very short deadlines that CMS has proposed for this engagement. I also wanted to mention that the directed payment programs, what we call DPPs, we had a special call meeting with this board a couple of months ago to approve a proposal, and CMS has begun approving states' DPPs, and some announcements were made yesterday. We were not in that announcement yesterday, and I wanted to reassure everyone we're getting questions from CMS, which is very normal, on these proposals and in conversation with them. And so wanted to make sure people understood that no decision has been made about Georgia, but we are working with CMS to make sure that they understand our proposal completely. At this point, I want to celebrate employee milestones. We have a fairly long list, Mr. Chairman, which is a good thing because that means that we've got folks that have been serving the state for many years, and we want to make sure we recognize them. The first is Dacia Hollins, Division of Financial Management for 25 years. Sharon Clark, SHBP, 25 years. Tanya Malcolm in MAP for 25 years. And Cheryl Williams, SHBP, for 25 years. Obviously, those are long-term employees, and we want to celebrate their being with us that long. Jetty Bristow is MAP for 20 years. Peeling Wu, the OIG for 20 years. Mary Branham, HFRD for 10 years. Peter Dalba in MAP for 10 years. Stephen Capel, Office of Planning, 10 years. Lenora Darian, Georgia Board of Dentistry Pharmacy for 10 years. Gloria Beecher in MAP for 5 years. Tiffany Doyle, Division of Financial Management for 5 years. Monica Cormier, CMO Performance Management for 5 years. Lauren Elizabeth Brennerman at the Georgia Board of Healthcare Workforce, 1 year. Safia Hamilton at Composite Board for 1 year. Jacqueline Cleveland, Division of Financial Management, 1 year. Joelle Grant, Office of Information Technology, 1 year. Rashika Sanias at MAP for 1 year. Christopher Harrison, HFRD for 1 year. Rachel Stewart, HFRD for 1 year. Kevin Crickard, HFRD for 1 year. Melissa Maddox, HFRD for 1 year. Sophia Bryan, HFRD for 1 year. And finally, Kimberly Ann Holland, Georgia Board of Dentistry and Pharmacy for 1 year. So, Mr. Chairman, I want to complete my report to you by saying appreciate you and the board's service in helping us to make Georgia healthier.
Thank you, Commissioner. Any questions for Commissioner Burke from any of the board members? Well, if not, we'll move on. On behalf of the board, we certainly extend our congratulations to all those employee milestones. No matter how small or how large, they're very significant, and we appreciate the service. We'll move on the agenda. We have one item to consider for final adoption this morning. And that item is newborn screening rate change. And it gives me great pleasure to call on Emily Hatchett, Senior Policy Advisor. Emily is a fellow Dublin person. And Emily, it's great to see you there. And if you will proceed, thank you.
Yes, sir. Good morning. Thank you, Chairman Folsom. Great to see you. Commissioner Burke and members of the board. My name is Emily Hatchett, and I serve as a Senior Policy Advisor to the Medicaid Director within the Medical Assistance Plans Division here at the Department of Community Health. This morning, I'm presenting the department's proposed newborn screening rate change for final adoption, effective August 1st, 2025, pending approval by the Centers for Medicare and Medicaid Services. The Department of Community Health proposes to increase the reimbursement rate for the Department of Public Health for newborn screening services. This increase reflects the inclusion of an additional disorder, Krabbe disease, which was approved by the Georgia Newborn Screening Advisory Committee. Pending board approval and retroactive to August 1st, 2025, DPH will begin screening for Krabbe disease as part of the state's newborn screening panel. The addition of Krabbe disease will result in a $7.93 increase to the current newborn screening fee, which takes that from $80.40 to $88.33 for fiscal year 2026. The estimated cost impact for fiscal year 2026 is as follows. The state share amounts to $138,813. The federal share will be $273,218, with a total combined cost of $412,031. As part of the final adoption process, the department conducted a public notice and comment period. A public hearing was held on August 18th, 2025 at 11:30 a.m. via Zoom audio, and written comments were accepted until August 25th. There were no oral or written comments received. Given the absence of any concerns or objections during the public comment period, the department respectfully recommends final adoption of the newborn screening rate change, retroactive to August 1st, contingent upon CMS approval. Thank you for your attention, and I'm happy to answer any questions.
Thank you, Emily. Any questions for her from any of the board members? If not, the chair will entertain a motion for final adoption approval.
Norm Boyd, I make a motion for approval.
Norm Boyd has made a motion for approval for final adoption. Is there a second?
Second, Kathleen Ruth.
Kathleen Roof has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. And any member abstaining? Motion is approved. It sounds like it was unanimous. Thank you, Emily, for that presentation. Is there any new business that needs to come before the board? Well, hearing none, we've had a rather brief meeting this morning, but I do want to extend an invitation on October the 9th for our next meeting, which will be held in Dublin. And we'll be finalizing plans next week, and Denise will be getting out information to you regarding that. But we hope to do some sort of laid back activities, maybe a dinner before the meeting the night before, if some of you can come in the evening before. And we will have some visitors for this meeting. Some dignitaries hopefully will be here throughout Middle Georgia and the state. And we hope that you can make the trip down to Dublin. We look forward to entertaining you for a few hours in Dublin. So if no other business, we stand adjourned. Have a good day, everyone.
Have a good day.
Thank you.
Good
Thank
day.
Hello.